Say 1, 2, 3.
1, 2, 3. Yeah.
Is this a...
That's a common question. The reality of it is that based on the condition, there's a time factor. And the time factor is maybe a week to 10 days, given the severity of the condition, could be as much as 3 or 4 months. So there's lots of other issues at play here that guide the doctor in terms of what his treatment plan should be. So coming 2 to 3 times a week for a few weeks, it's pretty consistent with the guidelines. It's not like medicine, take a pill and twice a day for 2 weeks and come back. Actually, if you use that as an analogy, when you're administered by the medical doctor using a pharmacological agent, you're actually being administered to twice a day for several weeks too. But you ought to be getting better, and that's the key. Yeah. So there is I'll call it a subspecialty in chiropractic called veterinary chiropractic. And actually it's quite a legitimate body of knowledge that guides the clinical decisions on the part of the on the part of the chiropractor. Chiropractor takes additional training. So there are men and women who have a love of animals and they want to administer chiropractic care adjustments, and keeping in mind that the animals have spines, and the spines have related to nervous systems, and the nervous systems control the body. And I would add, in collaboration with a doctor of veterinary medicine, which is what most chiropractors do when they work with animals. But keep in mind, it's very difficult to measure the outcome. That's where it gets a little uncomfortable, because with a patient you could say, listen, are you feeling better today? You know, I'm moving the joint in a certain way. Does that hurt you? With an animal, of course, there's no language interaction. Adjusting horses is one of the bigger areas that chiropractics and vets work together. And interestingly enough, racehorses. Now, here is again, it's anecdotal. The owner of the racehorse, if the horse wins, will tell you that the best thing in the world was the chiropractor. And if the horse loses, maybe not so much, because the outcomes, again, gets back to that place of how are we measuring whether actually the influence of the procedure is being done. One thing, if I had to really bring it down, it's intention. Why did you become a chiropractor? And if you can answer that with reflection and an understanding of who you are and the role that you can play in society. If that comes out to you want to help people, and you want to contribute to their ability to heal, the one thing that you absolutely need to do is be very true to that purpose in your life. The second thing you'd want to do is keep expanding your clinical skills. And then the third thing is, do not be naive to the importance of the entrepreneurial component to healthcare in America. If you fail to recognize that, you may very well have a wonderful practice but not be able to meet your financial obligations. So intention, lifelong learning, and a mature understanding of the business of healthcare in America.